Ladies and gentlemen, welcome to another episode of Stories Live here on Radivision, the new Entrepreneurship Network, where we have decided to celebrate our COVIDpreneurs. And these are entrepreneurs who are working on shit that matters and shit that saves lives. We want to hear the story about people like Rupert Spiegelberg from London. Welcome to the show. He's CEO.
Nice to meet you. And great pronunciation of my name.
Well, okay, I cheated because I'm German, so it's a German name. So welcome. You're joining us from London today. How are things in London?
Things are great in London. We're all just getting back to work after the summer break. The centre of London's filling up nicely. Our offices are in the heart of London in Covent Garden, which is probably relatively well known to those of you who've been to London. The only downer is it's a little bit drizzly outside. So apart from that, it's a great beginning of September.
I mean, arguably, I think at this point, the weather is your last thing that you worry about if you're living in London, right? I mean, you've gotten used to that.
That's true. That's true.
Yeah. We are in California. We're blessed with really good weather, so I guess
it's a very interesting time because we've had California style weather for the last couple of months, and of course we've all been in various stages of lockdown because of the coronavirus, and so which has made it bearable with all the fantastic sun, which is why probably you guys out in California are able to sort of suffer the lockdown. You can go out and sit by the pool or go to the park. What's going to be very interesting is as we approach winter and it gets colder and we've all got to be inside, is how we're all going to deal with the impact of the social distancing and wearing masks and all that kind of thing.
Right. Yeah, I call it a paradigm shift in humanity, and I think it's a once in a lifetime shift in how people do things, you know what I mean? And so that's really interesting. We'll get to Corona and everything. Rupert, I want to start with, I think you started on this side, right? You were a journalist.
That's right. When I left university, I had great aspirations of, walking the footsteps of great writers and philosophers, like Victor Hugo or Montesquieu and those kind of people. And as a sort of very pretentious young in my early 20s, I thought I would pursue the career of journalism, which I absolutely loved. I started life as a journalist for Bloomberg. I was one of the first journalists for Bloomberg in Europe, which was a fantastic start to a career. And what it sort of enabled me to do was really to get this incredible exposure to these fantastic business leaders. I was there 22, 23. I was having one-on-one interviews with chief executives of Daimler-Benz and Volkswagen and BP and all these incredible sort of industrial titans, which gave me a real sort of thirst and wanting to sort of actually get involved in business myself. And so it was a great sort of baptism of fire of the business world.
It's funny. I think I love doing these interviews partially because I get to ask funny questions. But I think like the essence of entrepreneurship is really just asking questions, right? Like, and then obviously dreaming big. But I think when you are exposed to that many smart people, you learn by osmosis. I mean, you're absorbing really, really interesting, relevant, creative content from people who are actually building stuff, right? So that's why I doing this as well.
And I was actually one of my beats while I was at Bloomberg was covering the IPO market back in the 90s. So there you got really sort of first-hand knowledge of some fantastic, really innovative and dynamic companies, and then just listening to these really inspirational people who had bootstrapped their companies, were now sort of raising money and had great ambitions for changing the world was really inspirational. So I wrote a lot of stories, really sort of, background stories about these people and what they were doing and how they got there. And it was a great time, and it was actually a great time in sort of business history. It was in the, and I'm slightly giving out my age here, but it was in the late 90s, just before the first sort of tech bubble, and so that's what kind of made me cross the Rubicon from writing about it to actually doing it. Having written stories, business stories for about 3 or 4 years, I sort of thought, as the tech bubble started to, the sort of the excitement around the internet, as it was then called, sort of grew and crescendoed at the end of '99, early 2000. I thought, I'd got to go and do this.
And then you landed in kind of SaaS and security and AI. And so what was that experience like, that transition? And then, again, we're talking about the early days of the internet where it's kind of everything was a blank canvas. Tell us a little bit about the next phase of
Yeah, those are the days. People didn't talk about SaaS or AI back in the early 2000s. I can't even remember what they did talk about. There were these sort of cool companies called Amazon and Netscape, and companies like Time Warner and AOL were merging, which probably most of the listeners today might not have heard of AOL or those kind of companies. What my first company that I started in beginning of 2000 at the sort of height of the bubble was actually today it would be called a SaaS, cloud-based, white label platform for stock trading. We sort of just called it, I'm not sure what we called it back then, but people didn't talk about SaaS. They did talk about platform plays and building things that you could then repeat. You could sort of repeat and provide to multiple clients. But it was it was around the time of the rise of Ameritrade and E-Trade and all the traditional stockbrokers at that time. That was the sort of second and third tier stockbrokers really thought that they were going to have their lunch eaten by Ameritrade and E-Trade, who were offering cheap and easy share trading. So we wanted to provide them with a white label platform that they could have effectively their own instant share trading platform. When we raised about $10 million, we opened offices in New York, in London, and Sydney, and knew a lot about stock trading and finance, knew nothing about the internet or technology, and managed to spend $10 million in, I think it was 8 months. And by the end, I had very little to show for it, and we didn't even actually manage to launch our platform. So it was a complete disaster. So fortunately, I started at the bottom and worked my way up to, luckily, to have some successes thereafter.
It's easy to spend money if you quickly. So that's okay. So we're talking, Internet 1.0, right? No SaaS, no platforms, no apps, not even an iPhone, right? No,
iPhone was.
I was around, by the way. I remember the AOL dial-up. So I had a Commodore 64, I think it was. So I was around. But so you spend this time and you fail essentially to some degree. You get up again, and then it's funny. You said something about changing the world. So if we want to transition to now where we are, how does one get recruited to change the world? Because especially in a vertical that arguably you haven't been in health tech. So how did that happen?
That's a really good question. I've spent most of my life in really fintech and regtech world. I was running a company in Germany a couple of years ago, a digital identity company, a digital identity sort of platform. And I was actually commuting between London and Munich for a couple of years, every week, sort of going to Munich, flying to Munich Monday morning, coming back Thursday. And after a couple of years, I kind of sort of had enough of doing that. It was taking its toll on me and my kids. So I decided I wanted to sort of get back to London, and was looking around and talking to people and feeling very much that I was at a sort of time of my life where I kind of wanted to get involved with a business which had a sort of which was a good business in itself and had operated in a fantastic market, but also had some sort of higher, well, I don't want to say higher purpose, but some greater social value. Healthcare is an obvious sort of destination for that kind of thing. And obviously matching healthcare and technology is an obvious sort of destination. I think, clearly I needed to go somewhere where I could use my skills, use my experience. And the more I looked into it, well, the more I saw where healthcare was in relation to other sectors, other industries. If you look at financial services, if you look at retail, all of those industries had really had their sort of online moment, years and years ago. Retail probably 10, 15 years ago, financial services really had its sort of online moment, more recently, sort of 4 or 5 years ago, with the rise of the sort of what they call in Europe, the neobanks. And healthcare really just hadn't got there yet. And I think, but it's starting, and there is a fantastic ecosystem of health tech companies. I think, we're in the very sort of early stages of what Gartner would call the sort of hype cycle of health tech. And, what's been fascinating, a lot of people who've been in health tech for 2 or 3 or 4 years have really been knocking because health tech companies have to really deal with very large, complex, and highly regulated organizations, healthcare providers, large insurers, payers. These are very sort of Byzantine organizations, whether they're publicly owned or privately owned. And some of the real visionaries and the early starters in this world, found it really, really tough to sort of break into a lot of these big organizations. DoctorLink has been around now for about three, almost 4 years. And, when we started, it was a real uphill struggle to get sort of noticed and to navigate these organizations. But, what has happened in the last six to 9 months with respect to the coronavirus has really kind of opened people's eyes to how technology can support the system and can really provide huge benefits, not only for patients, but also for the providers. So I think, the level of acceleration that not only that we've seen, but I'm sure all of our competitors and other players in this industry have been seeing in recent months, really speaks to that old Warren Buffett adage of, when the water's out, you can see he's wearing no trunks, no swimming trunks. And the COVID pandemic has really shown which of the providers and which of the systems really were creaking at the seams prior to, as the demand for healthcare has rocketed exponentially in pretty much every single country on the planet, whereas the supply of healthcare has remained relatively stable, because you literally just can't magic doctors and nurses out of thin air. So it's been an amazing, well, amazing I think is actually the wrong word. It's been a very it's been a very challenging time, but it's been very gratifying to seeing how actually the technology that we are producing is really going to serve a sort of a greater social purpose. It sure beats selling CRM software or other types of services like that.
3 quick questions about this concept of joining DoctorLink later on. What stage were they at? What stage was DoctorLink at as far as when you connected?
In terms of funding, or in terms of
audience understanding of kind of how these kind of things happen? Because again, it's not typical for someone to join a little bit later as a CEO. But so we want to talk about, how that happened. Did you find DoctorLink? Did DoctorLink find you? And then maybe just I can follow up with, was there a specific moment when you said, holy guacamole, this is awesome, or this is challenging, and I want to be part of this? And what was that moment for you?
Sure. So DoctorLink's is an interesting company. It was really born out of another company, which was effectively a sort of clinical services company, and our owner is a venture fund called 8 Roads, which is owned by the asset manager Fidelity, and 8 Roads has a long and very successful history of investing in healthcare assets in Europe, in the States, and in Asia. And the owner of or the president and CEO of Fidelity, Abigail Johnson, is a great advocate of healthcare and healthcare investment, and 8 Roads, and the idea was really around wanting to optimize, sort of digitize primary healthcare pathways, which is a sort of rather sort of jargon-esque way of saying it is basically sort of migrating your all the touch points with your doctors to an online experience, whether it is figuring out what's wrong with you, booking an appointment, getting your prescriptions, and all that kind of thing. So DoctorLink didn't have to. So DoctorLink was effectively founded and funded by 8 Roads, and 8 Roads built up the team, and it had a great sort of startup team. And my experience, while I've been involved in startups for most of my life, is moving startups from startup to scale up. And the company was just at that right point in time where the stage it was at and its trajectory and its growth profile very much sort of matched my experience and my strengths. In terms of the sort of moment when I thought this would be a great business, I think very much from the start, very much when I talked through with the shareholders, with the board about it, with its prospects, how well it was doing, and actually, and we may talk about this a little bit later, but the sort of magic of the technology, and it sounds a little bit cheesy to talk about it like that, but what we have at the heart of DoctorLink is some really amazing technology which effectively can decipher what is wrong with you through some very advanced and sophisticated algorithms, and that creates a huge amount of opportunity for healthcare systems, for payers and providers together, and it just felt like something which had a unique. We weren't just building sort of another sort of platform to be able to access health services. There's something really at the core of this that is truly unique, uncopyable, and something you can't get anywhere else. Does that make sense?
Yes, yes, yes. Okay, so you join. This is pre-COVID, right?
Yeah.
And things are going well. You obviously are in England, where you have the NHS, yeah, and so public healthcare. So tell us, what were you doing pre-COVID, or what was happening? Or what was
So well, I remember it quite well actually, because we were moving along quite nicely, fighting the good fight in terms of trying to persuade the NHS that they needed to roll this out faster, within the system. We were also starting to engage with insurance companies, other health tech providers, and other healthcare providers around the world about the benefits of the platform and the products and so on. And getting lots of meetings, getting lots of interested parties, getting lots of head nodding, and yeah, that all sounds great. But as I said to you earlier, we're dealing with and engaging very large, complicated, highly regulated, very risk-averse organizations. And so on the face of it, people were sort of generally, this all looks great, and yeah, it's amazing, and so on and so forth. But to sort of stimulate the inertia was quite difficult. We had quite a lot of traction within the NHS. We had about at the time 6 or 7 million patients. The platform was available to 6 or 7 million patients at the time. We've got a great, we had a good long-term US business as well with one of our health risk assessment products, and work for some of the big sort of organizations over there, like Kaiser Permanente and McKesson and so on. But it was hard yards, as anyone who's started a startup and built a company from the ground up knows. And then I remember in January, they're reading this stuff about something happening in China. I remember it was early January, and it sort of felt a bit like the SARS story, the MERS story, which SARS is slightly different, but MERS was a story which kind of sort of sat at the periphery of the news cycle, because it never really sort of hit Europe. I don't think it even got to the States, actually. I think it was in Mexico a little bit. But, so it was a sort of point of interest. And so I started sort of looking at it a little bit more closely. And I remember calling up our chief medical officer in about mid-January and saying, look, have you seen this Wuhan thing going on? How does this impact us? And he said to me, yeah, we're on it. We've been looking at it. This could be potentially, he didn't know at that point. We'd already been through the sort of SARS and MERS thing, and he said, yeah, this could be something potentially we need to look at. And we started our clinicians working on creating an algorithm to help people understand, to be able to assess whether they had the appropriate symptoms. And actually, they did a fantastic job. And within 10 days, they had added to our overall algorithm. And we were the first company globally that was able to provide a digital algorithm to as a first point of assessment for patients. And I will confess, at that point it was relatively unsophisticated, because we actually didn't know very much about the disease at that point. So our algorithms are really built by doctors and nurses and other clinicians in-house, based on sort of current medical advice and guidelines at the time. And there was relatively little, it was about correlating where you travel to, you know, the cough issue, the sort of lack of taste, the loss of taste, and so on. Anyway, we put out the first algorithm. I think it was, you know, January 21st or 22nd, and then it just sort of started blowing up, you know, late February, early March, and you know, it just, and then by mid-March, late March, you know, in the UK we had a lockdown, and the NHS just literally just changed its position overnight. It stopped all patients going to see general practitioners on a face-to-face basis. They locked down A&Es, and effectively the entire system had to pivot on a penny in terms of how it was approaching how it was going to handle healthcare across the whole country. And you know, what was fantastic from our point of view is that we work with, you know, quite a lot of the region. In the UK, the NHS is split into a number of regional trusts, and we work with a number of those. We work with a number of those already, and you know, we went along and said, look, we've got algorithms where we can determine we can assess whether there's a high probability or there's a decent probability as to whether you have the coronavirus or not, and that we can use that as a first line of defense in terms of assessing where outbreaks are. So we started working with the various governing bodies in the UK and helping them identify that. And of course, our DoctorLink app, which was installed in you know, hundreds of GP surgeries at the time, and now it's thousands, over 1,000, was able to meet the new requirements for NHS interactions, i.e. that people were able to assess their symptoms, book an appointment, and actually then have a face-to-face video consultation with their doctor, all online, without any need to go and actually physically see the doctor. So we had a sort of out-of-the-box solution ready to go, and you know, it was a very sort of opportune moment, and we were able to work very closely with the NHS at that point. But as you can imagine, a lot of those phone calls that we'd been having 6 months prior, and people going, "Oh, this sounds like it might be a good idea, but I'm not sure." Suddenly, we're getting the calls back saying, "Right, when can we get this implemented?" Right. So you know, it was good, but we invested a lot of time and effort to make sure that we got those algorithms right, and that we could really help sort of identify those potential issues.
So that's interesting. So basically, at first, you're solving an inefficiency, arguably a nice to have for the NHS, and then all of a sudden they go from that, like you mentioned, pivot. So typically, pivot means a different direction, and so here the different direction is from zero to full throttle. We must have this now. Tell us, you know, again, so we don't have the NHS. Does it make it harder or easier to deal with one entity like that? I mean, obviously, what if they don't like your stuff and you're just dead in the water? Or how does that work?
Nima, when I say pivot, we've got to remember the NHS is a million person organization.
Wow.
You know, it's one of the largest employers in the world. I think it's one of the largest employers after the Red Army in China. There's some sort of data point like that. So the NHS does not, but for the NHS, it moved pretty rapidly, relatively so, and it was very interesting, you know, seeing how they operate. It's a very, very complex organization. It's, you know, it gets a bad rap, but it is one of the most amazing, you know, it's if they say that, in the UK, they say that, it is it is probably the most cherished institution in the UK. People absolutely love it and adore it. And they put up with its eccentricities and its foibles, and it often makes mistakes, but it gets there in the end. But it is complex. It has that money flows through the system in quite strange ways, which don't match normal commercial organizations. And the incentives and the priorities of different levels of the organizations are very different. So it's not it's not run like a sort of normal commercial organization. So it is it's quite difficult as a commercial organization like ourselves. It's quite difficult to sort of navigate that and understand how best to handle different parts of the organization. So we have there, in very simplistic terms, there are 3 levels to the NHS. There's NHS England, which is the overall body which received the funding from the government, and then they allocate that money to the regional trusts, and then the regional trusts then pay the individual surgeries, the doctors, and we sell to the middle bit, the CCG, what they're called the CCGs, and of course we sell something to CCGs, but they haven't necessarily at that point got the buy-in of the doctors, and so we also have to get the buy-in of the doctors and the CCGs and NHS England, and all of them have competing priorities and incentives. So it's quite a sort of complicated sell.
And so just to give us a sense, how many solutions do you think they were evaluating alongside your solution?
There was 2 or 3 others. I think each solution is slightly different in terms of its benefits and so forth. I think we had an advantage where we were embedded and had been embedded for quite some time. We've got some great provable data to show the advantages of it. We were also a sort of an out-of-the-box solution, tried and tested, so sort of had a head start. I should add though that we didn't win all the mandates across the entire country. But we won more than half of them.
Wow.
So we were definitely sort of the largest supplier in that space. They have a very sort of formula-driven sort of tender framework. Actually, in some areas there are up to 30 different suppliers on that framework. So because it's a taxpayer-funded government organization, they have to have sort of open tender processes and open it up to a sort of broader set of stakeholders as possible.
Like a clinical trial for software. A clinical trial for software.
Yeah, it's a bit like that, but it's very interesting, and also, unlike in the commercial world, they're very open about that process, and they share all the information, and they provide feedback. So it's a very transparent process, and it's anyone who's bid and tendered with any kind of government organization. We did a little bit in the United States as well, and in Canada, and they're very sort of similar sort of systems to navigate. Dealing with governments is always a tough call.
Right.
And
so you were on a trajectory of growth, and all of a sudden someone turns on the faucet. How did you deal with managing all now the inbound calls and infrastructure wise, as far as a company,
Well, and then Nima, don't forget, we just went into lockdown, right?
Right, exactly. During this time, that was my point.
So we closed down all our offices, and we were one of the first companies to do that in the UK, because obviously we were sort of acutely aware of the issues of COVID, so decided to do that. I think, I think that was a good decision in hindsight, because we've got a young and healthy workforce, but clearly, if we had someone who contracted COVID and then spread it, and half the office was out of business for 2 or 3 weeks, then we would have been in serious trouble as an organization. As it turns out, one person did get the coronavirus, and I think only one person got it, and that was me. So I got it right at the beginning in March. I think I caught it. I had to take my daughter to A&E, and I think I caught it there. So luckily, we'd actually locked down at the time, so I hadn't been into the office, and fortunately was not didn't commit infect any of my colleagues.
Wow.
So we were going through a period of intense growth. We had we went from office working to virtual working straight away, and I was struggling in bed with COVID for the first 3 weeks. And I have to say, I was very fortunate that I wasn't asymptomatic, but I wasn't in hospital, but I was one of those ones that was kind of sort of in bed for a couple of weeks. So it was a fun time.
Wow.
That's what startups and these kind of companies are all about.
So, look, I hate to say it this way, but this whole move to the virtual world and these 7 Zoom meetings a day, and having interactions, whether personal or again with your doctor, so really the outbreak put on kind of turbochargers to your business model in a sense, by just even again changing the user behavior, right? So I would argue I had never seen a doctor virtually, and I probably have
you done it?
Now I have done telehealth, yes. And look, the reality is that even outside of Corona and COVID, most of the stuff that people get is pretty simple to diagnose, and in that sense, in theory, I would argue that the healthcare system simply is just super inefficient, and so at least the inefficiencies are going to be fixed. But the point is that, like, in a sense, now even you and I talking, it's more natural, right? It feels organic, it feels safe, it feels okay. And so I would argue that I will consider, okay, do I really want to get up and go to the doctor versus doing telehealth? Again, so I would say that in some really screwed up way, this outbreak has helped your business accelerate, right? So
totally. I think I kind of agree with you. Healthcare is really complex, right? So there's no panacea. It's not like saying, oh, I can do my banking online now. There are lots of different levels of engagement with healthcare services. We are definitely not in the business of replacing doctors. We're not in the business of replacing, what I call sort of, hardcore healthcare, the business of properly curing people, right? What we're about is really at that front end of that process is sorting the wheat out from the chaff and making sure that the doctors and the general practitioners can operate at the top of their license. My stepfather was a general practitioner for 40, 50 years. And I remember sitting around, he would always come back from work, and I'd have to hear his stories of patients that came in each day. And I always struck me very strongly that he would say, literally 40, 50% of the people that came to visit him had no medical problem whatsoever. And actually quite a lot of them were lovely sort of old ladies or old men who were just a bit lonely and just wanted to come in and have a chat. which is fine. But that is not what a GP spends, 7-8 years in medical school training for. And what doctors want to do is what they talk about a lot in the profession is operating at the top of your license. You want to have access to and see people who are properly ill, who need medical attention and need to get to see the right specialists as soon as possible. So if your surgery times are sort of congested up with people with colds or sore throats or slight abrasion somewhere, you're actually, what you're doing there is you're blocking the people that really need to go and see the doctor. So, and that's really what DoctorLink is about, is in terms of our triage service, is really sorting the wheat out from the chaff, in the sense of there is, we found that in our operations over the last couple of years is that about 30% of people that go and see doctors don't need to see the doctor. They could quite easily just stay at home in bed and have a nice cup of tea, as we like to do in the UK, or go to the pharmacy and talk to the pharmacist about the right kind of drugs and so on. So if you can sort of just move those people into sort of self-care or pharmacy, or maybe that it's so serious actually they shouldn't wait and see a doctor, they should go straight to A&E. So if you can get people going to the right place at the right time, and then you clear the pathway for the doctors to be able to see the people that they need to see, and that those people will get to see the doctor faster and get the right treatment, and that you will get better outcomes from that process.
That's awesome.
Sorry, I got a little bit on my triage hobby horse there, but it's a really important story for healthcare systems. Triage is actually it's a relatively new discipline. It's about, I think it was first used in the Napoleonic Wars in the early 19th century as a means of prioritizing the wounded on the battlefield. So if they saw that you were about to die, they would just put you in one pile. If they saw that you could sort of get better by yourself, they'd put you in another pile, and then they would have a pile of people who would benefit from medical care. So by assessing people, prioritizing them, and getting them to the right care, you would do the best benefit for the greater population. And what we're doing with digital triage is really bringing that process, which is fully embedded in every healthcare system around the world. It's every healthcare system has a triage system and triage process, but it's all done manually. And what we're doing is really just bringing it to the 21st century and digitizing that process. And I say that's kind of what we're doing. It's quite a complicated task to do that, but that's effectively what's happening, and that's why it's been so effective.
Rupert, in one of your decks or presentations, is that number close to let's call it $1 trillion a year in inefficiency, as far as
no, not $1 trillion. So when we look at the UK, for example, there are about 360 million GP appointments every year. 360 million. So on average, people go and see their general practitioner about 5 times a year. I would have thought in the States the number's probably not that different. It may be slightly lower because obviously in the UK it's free to go and see your general practitioner, whereas depending on your health insurance, it's not necessarily free.
Yeah, it's definitely not free
in the US. So that probably brings the number down a bit. But there are 360 million GP appointments a year. So, as I said, our service has been in the surgeries that we've deployed it in has reduced the amount of appointments by 30%. And so, if you extrapolate that across the country, then that is, effectively by effective digital triaging, you can reduce the number of GP appointments by about 120 million a year.
Wow.
Which, if you wanted to put a number to that, the cost of a single GP appointment is probably somewhere between 30 and 40 pounds. It's about $50–60 each time. So, and I'm going to get in trouble for doing the wrong math, but that's sort of close on to a sort of $1 billion cost saving. And I think the way that a public health system like the NHS would treat that is not as a saving in terms of money, but it just means that they can add capacity to the system without needing to incur additional cost. Right. And also you would provide better, a lot of the issues in the UK around being able to see a doctor within a certain time frame and so on and so forth. In the States, for example, that actually might be, for insurance companies who have to pay for those GP visits, they would be highly incentivized to want to deploy some kind of online triage tool, so they don't, when Nima goes, rings up and says, look, I want to go and see a doctor because I've got a little cut on my finger, and they will say, well, actually, you've got to go through our digital triage assessment, and if it says no, then you can go stay at home and put a plaster on it, and not suck up our costs.
You should do a collaboration with Greenpeace and figure out the reduction in CO2 emissions for those appointments. That would be
I like that angle. I like that angle as well.
Uber, we've been talking for 45 minutes and we have some questions from the audience. But just as a whole, what's your thought about what's going to happen with Corona and this outbreak? And is there a vaccine coming? Is there to be heard? What are your thoughts?
I think look, I'm not a doctor. I'm not an epidemiologist. I read the news like everyone else. I probably read it a lot more closely because it's so than most people, because it's so much part of our business. I also watch the numbers, the infection rates around the world pretty closely as well. I think the biggest, and also I talk to a lot of senior people within the NHS and within large organizations. I think, I think quite interestingly, what people are most concerned about, obviously at the moment, is a second wave, and hello, sorry, I lost you for a second.
Are you there? We lost you for a second.
Yeah, but I think actually there is cause for quite a lot of optimism going forward. It seems, if you look at the ratio of infections and mortality rates, they're going down, and I slightly wonder whether it will be downgraded as a sort of threat to human health and brought more in line with a sort of traditional seasonal flu and so on. It feels to me that it is it's going to be less of an issue as it was in the first quarter of this year. And I think the difficulty will be is governments around the world have totally scared populations into being very cautious about this, and I feel that that their job to do now is to sort of bring them back from the edge and manage it in a much more sort of in a less what's the word, panicky way, I guess. Does that make sense?
Definitely was a fire drill for a minute. Well, we wish you the best. We have some questions from the audience. I'm going to highlight them and read them as well. Just so, I don't know if we talked about this. How many patients are you serving in the NHS?
So the platform now, we now have about 12.5 million patients with access to the platform. And we're growing that every single month.
Awesome. And I know we touched on this again before a little bit, but if you just want to summarize what makes DoctorLink so unique compared to your competitors.
Sure. So we've actually had there's been an independent study on on DoctorLink and other competitors, which is currently being submitted for peer review, and we hope actually will get published by the British Medical Journal or the JAMA in the States, or one of those other peer-reviewed journals. And what makes DoctorLink, in particular online triage product, distinctive is it is the safest in the market. It's the most accurate, and most importantly, as well, from the provider's point of view, is the most effective at getting patients to the right place first time. So quite a lot of the online triage, we call it online triage. In the market, it has lots of different names. It could be called symptom assessment. They're called health chatbots. They have lots of different names, and there's a sort of spectrum of how good they are. Where at one end of the spectrum you've got Dr. Google, put in your symptoms into Google, and then at the other end of the spectrum you've kind of got DoctorLink, and then a lot of the others play along that spectrum in terms of how accurate they are. But what they do not do, which DoctorLink then adds into that, is it tells you it's not only very accurate in terms of assessing what your symptoms could be, but also makes a judgment as to how acute they are in terms of, do you need to see someone now, in 12 hours, 24 hours, or a week, or so on, and then actually sends you to the right endpoint, whether that is a pharmacy, self-care, GP, A&E, urgent care, or to a specialist. So it is effectively as good as, and in terms of accuracy, as a real world human. And I think it's just having it. I don't think any other system out there can claim to have that level of accuracy.
That's awesome. Okay, last question, and I think we talked about this, but again, you started as a journalist, you were a philosopher. When did you know that you were an entrepreneur?
I don't think I ever did know. I just I kind of wanted. As I said, I think when I was working at Bloomberg and spent all this time interviewing all these great titans of industry, I kind of just felt like I wanted to do it, and I didn't really think about it as being an entrepreneur at that time. I just kind of wanted to roll my sleeves up and start building businesses, and I don't claim to have any greater knowledge than the next man or woman in terms of being able to do it. I just kept trying. I failed a couple of times. I've been sort of moderately successful, and it's just been a lot of fun doing that. So I think I didn't really have an aha moment. I just got into it and loved it and just wanted to do it more and more.
That's awesome. Well, whether aha moment or not, or you knew it, we want to celebrate you and congratulate you on the work that you're doing. Keep up the good work, and hopefully we'll see DoctorLink here in the US pretty soon. And again, stay safe. I'm glad that you recovered from having the virus, and thank you for being on the show, and all the best to you, and good luck.
Naeem, it's a great pleasure. Thank you very much.
Thank you, Rupert. Ladies and gentlemen, another episode. See you next time. Hope this was interesting, and peace.